Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Doctor, thanks for being with us.
Good morning.
Hey, good morning.
So let's talk about these vaccines. Couple of questions. Is the second booster going to be the same as the same kind of shot as the first? And also, should you be waiting for the Moderna one? Should you just only want the Pfizer one? How do you know when it comes up?
Yeah, a good question. First of all, the booster is just the timing of the second dose. It's the same.
Okay.
It's exactly the same. Dose one, booster dose, dose two. So no difference.
All right.
Whether you take the Moderna or the Pfizer, it looks like they work just the same. We've got a little bit. We have one more week of data with the Pfizer one, and if it's distributed, I would say if you need a vaccine for COVID, take whichever one you can get. I don't know if you're going to have the luxury of choosing which vaccine you're going to have access to at this particular stage. Maybe later on in the spring and summer, you might be able to choose.
I heard a couple of experts say yesterday that after the vaccine, you can still spread it. It just keeps you from getting really sick. Is that accurate?
Well, we don't know. That is a good question, and it's been brought up regularly over the last few weeks now that the vaccine is rolling out. We don't know if people that have been given the vaccine can actually still have a low-grade infection and have virus and spread it. And so they've been recommended to continue to social distance and to wear a mask. It's unknown. It's unlikely, but it's a possibility, so we have to see. So that's being studied now.
There's also a study out of the UK, something about COVID having a faster spread. Talk about what's happening there in a certain part.
So these viruses mutate very frequently, very, very fast. They're always changing. And sometimes the change can be for the good for the host, and sometimes it can be bad for the host being the human. So I've only seen the report that you're referring to. I don't know any more details than that. And they suspect that a strain of it, I guess we would call it a strain, in the United Kingdom is spreading faster than the regular strain. And they're having intense activity of the virus in the UK right now with doubling, kind of like we have every 7 days in the number of cases. So this is not good. So we don't know any more than that. It's been noted in the UK. These mutations can happen, and it has to be investigated very thoroughly, and it is.
All right, let's get to viewer questions. How is it that the COVID vaccine could be rushed through while other vaccines take years? When I hear that, it makes me think that corners were cut, and I am concerned about the safety of this vaccine.
This is a very fair comment, but I want to assure you there are 4 good reasons why this thing got developed so quickly. Number one, it's an emergency. All hands on deck, Operation Warp Speed, let's get this, pivot, just concentrate on this. Number two, the companies that do this typically are small biotech companies like BioNTech and Moderna. These are not big companies or anything. They got infused with billions of dollars, huge amounts of money, pre-purchasing vaccines that had not even been developed yet. So that really helps. The third thing really is the technology. The technology has advanced so much since the last time we made a vaccine. They had the virus genetically sequenced. It was kind of like ready to go. I mean, it's incredibly amazing that this thing got developed this quickly. Now, the corners that have been cut is that typically we look at a vaccine the entire safety profile for 1 year after the person has received a dose. Most of the complications occur way before 1 year, but that's a standard time to do it. And we're not doing that this time. The people who've been in those clinical trials, it's been 2 months. However, remember, these trials are huge. 43,000 in the Pfizer trial, 30,000 in the Moderna trial. Those patients are still being followed. Those participants are still being followed. And so there's this sentinel group with tens of thousands of people that are way ahead of what the public is going to get. So by the time the public gets the vaccine, we're talking March, April, May, something like that, there's going to be a lot more long-term data, and you should feel very comfortable about it. So those are really the four things. So those are a good explanation. And they really did not cut corners, they just sped things up.
All right. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Have a good day.
Thanks, Doctor.
Already.
Oh, we're going to get to know him a little bit better coming up in voicemail. Don't forget.
Oh,
Some
all right.
viewers
Yes.
wrote about you, Dr. Murphy. Don't go
Stick
anywhere.
around.
I
Hey, Paul.
promise I won't.